I too would like to acknowledge the traditional custodians of the land on which we meet today, the Gadigal people of the Eora Nation, and pay my respects to their elders past and present, to welcome any people from Aboriginal or Torres Strait Islander communities today, and to acknowledge the wonderful custodianship of the land over the last 60,000 years. I'm delighted today to welcome you to the 6th Cancer Innovations Conference of the Cancer Institute New South Wales. But before I go on with the formalities of the day, I'd like to ask, are you okay? September 14 is Are You OK Day, and you know, we live in big bustling cities with the challenges of time constraints. How many of us really know our neighbours on our street? Know people across our organisation, and are confident to actually turn to the person beside you and say, are you okay? I think our community can change dramatically with some very simple processes. It's particularly important for us in cancer care that we do not only look after patients, but that we look after each other. And asking, are you okay, is perhaps not part of our mantra in cancer care. But there's no doubt that looking after each other is crucial if we're going to come back and continue to provide excellent care, to be present for people on a day-to-day basis. When you sat down this morning, as Julie's already said, there are instructions for the app. Please use it. The team have worked really hard to make the app available, to make it exciting and engaging. It is on my phone. I'm also honest enough to say I didn't load it myself because I went to someone who was much younger. An important focus for the cancer plan is that we are improving cancer outcomes significantly across the state. And as we'll hear this morning, one of the things that we can do is put much greater emphasis than has ever been there before on the issue of smoking at the time of diagnosis. Because, as we'll hear from Dr. Warren later this morning, there is no doubt that people who quit smoking at the time of diagnosis have better survival, not only cancer-specific survival, but also all-cause mortality is reduced. Now, we as a community invest heavily in cancer infrastructure, in new technologies, and yet here's something that we can use on a day-to-day basis, and every health professional, nurses, allied health practitioners, doctors, can take the ownership of identifying people who are smoking, provide brief interventions, and importantly, refer on to the resources that are already there. The Quit Line, I Can Quit, one of our most used websites, resources that are available across our communities. We're also more than a year into a new cancer plan for New South Wales. This brings together stakeholders from across the state. It brings together non-government organisations, consumer organisations, healthcare providers in the public and private sector in order to improve cancer outcomes. Our opportunity is to build on the foundation of some of the best cancer outcomes in the world and ensure we're continuing to make them better. The plan, which was released on July 1, 2016, is already well underway. Please look at our website. We're already reporting annually against progress in each of the key areas identified in the cancer plan. It's tremendously important that we hold ourselves as a cancer community accountable to the communities we serve in order to say we are working to improve outcomes. Today I'd like to thank Uncle Alan Madden for welcoming us to country, to Julie McCrossan not only for facilitating as Master of Ceremonies, but facilitating the panel discussion with her energy and insights, and on this occasion, her experiences as well. A warm welcome to Dr. Graham Warren. As you'll hear in his introduction, he's responsible for the section in the 2014 US Surgeon General's report on smoking at the time of diagnosis of cancer. That US Surgeon General's report was a 50th anniversary report acknowledging the original link in the US between smoking and lung cancer. This update was as seismically important as that first one in 1964. It challenges every one of us to rethink our processes. To our panel members for today, thank you for putting yourselves forward for this discussion. We have a number of chief executives from local health districts here today, partners from pillars in New South Wales Health, directors of cancer service innovation managers from across the state, a number of representatives from primary health networks, Aboriginal medical services, translational cancer research centres. There are 7 of those that are funded across New South Wales by the New South Wales Government through the Cancer Institute New South Wales. More than 800 clinicians and researchers are coming together to ensure that we're taking new knowledge into clinical practice as quickly as possible, and importantly, that we're developing that new knowledge as we go. I would especially like to welcome consumers today, and consumers of cancer services, caregivers play a pivotal role in ensuring that we are continuing to develop services that are responsive to needs. Our panel discussion this morning is a Q&A session. Please use the app to send Julie questions. She will also be roving through the place with her microphone. Do not fall asleep. You can't fall asleep when Julie's facilitating a panel, but don't fall asleep, because I'm sure the microphone will be there to amplify your snoring. There are lots of posters in the foyer today. Please take time to read them. Please take time to also visit the tables where people have made the effort to present information. It's networking today, so there are breaks that are long enough to actually connect with people from across the state. Please take that opportunity. There are also prizes, as Julie has indicated, the best first-time oral presentation, the best poster, the People's Choice Award, the winner of the Translational Cancer Research Centre Rapid Fire Concurrent Session, and the winner of our afternoon Rapid Fire Plenary Session, and they'll both be announced this afternoon, so please stick around for that. As you all know, this year's theme is smoking cessation in clinical settings. We know the impact of smoking across the community. What we want to focus on today is very specifically smoking for people at the time that they're diagnosed with cancer. And I'm sure there will be compelling data that you'll hear today. Those of you who were fortunate enough to go to the masterclass yesterday will have had information to whet your appetite. But really, as we move forward, there is a paradigm shift. And this year's Innovation Conference is to really focus on how we can bring that into New South Wales. I hope you enjoy today's conference. We welcome your feedback so that we can continue to build a conference that meets the needs of the cancer community in New South Wales. So please provide evaluation forms as they are available. To move to our next session, I'd just like to acknowledge the work of Murrumbidgee Local Health District, and we're going to show a brief video that they've put together focusing on smoking broadly across their local health district. Have a great day.
We know that smoking is affecting nearly all the organs of the body and is a major contributor to death and disability across our region. Murrumbidgee Local Health District is absolutely committed to the New South Wales State Health Plan, which targets reduction in smoking right across our populations. And we know that when people come into hospital, there's an important opportunity for our conversations with patients. If every clinician engages in this opportunity, together we can all make a difference in reducing smoking rates in our population. We know there are benefits directly related to patient care when we do that.
The policy of providing brief intervention in hospital brings my role to the forefront. We really need to address the high rates of smoking, the high rates of COPD, the high rates of lung cancer in our district, and by identifying those smokers perhaps early in the disease and referring them to the appropriate health professionals, we can really make a difference to our patients. If we think about the challenges to the staff, thinking about nicotine dependence is just an extra challenge for them. I think what we really need to do is make it a priority so that all staff realise the importance of helping people with their nicotine dependence.
What we've been able to do with our integrated care project is make sure that our staff are appropriately trained and they feel confident to be able to have the right conversation in the right setting, so the patients don't feel like they're under any pressure and we're not actually interfering with their relationships, but actually putting it in a positive frame and letting them know that we're here to help them. We can coach them through this and work on it as a team.
So in my experience, if we take the opportunity while they're in hospital to start with the interventions, implement the nicotine replacement and provide that follow-up afterwards, we have more success.
Not everyone might know that it's also, the policy also states everyone deserves a brief intervention.
Patients are not always ready to quit smoking when we first offer it to them, but if they present again and we give them another opportunity, they may be ready the next time. So it's important that we offer them every time they present.
So in my experience, when a patient is hospitalised, particularly if they're hospitalised for a tobacco-related illness, they're very open to that education about smoking cessation. Most smokers do want to quit.
For our service and our frontline clinicians, there's nothing more exciting than a success story. And to be able to work with someone in the community to help them quit smoking is a pleasure and also a really rewarding experience.
If you're doing brief intervention and it is an everyday thing that you do in clinical practice, it empowers the smoker, and if they feel empowered, they might give up smoking and therefore have less of a burden on the health system, but it also have a healthy lifestyle for themselves.
What will make this successful in Murrumbidgee Local Health District is making it sustainable. So actually having the procedures in place and the resources in place so that it's an ongoing commitment. We need all health professionals to be on board. We need the nurses, the doctors and the allied health and the pharmacists to all make it a priority for our patients.